Well, good evening, everybody. I hope everyone's having a good night. This is Dr. Stephen Walker coming at you live on Twitter, Facebook, and YouTube. This is my twice a week mental health live stream where my only hope is to normalize conversations about mental health, expose people to different mental health clinicians. We've got a great guest tonight. We've got Kim Alima out of one of my favorite places in the world, the beautiful island of Oahu. She's a licensed marriage and family therapist, an EMDR therapist, certified EMDR trainer. So we're really, really lucky to get her. And if you remember from Tuesday night's show, we were talking about rational motive behavior therapy. And what I'm doing is I'm trying to do shows that expose people to different types of mental health treatments, mental health interventions, so that you guys can understand that there's no difference between going to a psychologist or a licensed counselor than it is going to any other mental health or physical health or dental health or whatever health professional. So real quick, just to remind you guys, I've started a fund called helpahuman.org. And what that is a fund. I get so many requests for people who are hurting these days with to do treatment. They don't have any health insurance. They don't have any money. I do my best to see everybody who I can. The realities of an economic-based society is I wish I could give my services away. I wish I didn't have to charge anybody. I wish I didn't have to ever deal with a health insurance company. Don't hear that, Blue Cross, Blue Shield, and Cigna. I love you guys, but I wish I could just give my services away. This is a fund that you can donate into, and then I use to help people who can't afford treatment, okay? If you've got some desire to help a fellow human being suffering, go to helpahuman.org, and you can donate to that fund. Again, if you're catching me on YouTube, please like or subscribe to the channel. It really, really helps us get our videos up higher in the rankings, and more people will. I have to do the annoying graphic. I'm really, really sorry, but here it is. I know, I'm sorry, but what can I tell you? So, all right, we're going to go ahead and bring in Kim. Remember, these mental health live streams are for you guys to ask questions. Kim, like I said, is a licensed marriage and family therapist. So if you have a question about that, if you have a direct question about EMDR therapy, you can talk about that. So what we're going to do is we're going to talk for about, 20, 30 minutes. And then please keep your questions and comments coming. We're going to get to as many of them as we can, because again, this is a mental health live stream so that people can ask questions and engage with us. So let's bring Kim in. Kim, are you there? Can you hear me from Hawaii?
Yes, I can hear you just fine. Thank you.
Great. And just to let people know, the only way I let Kim on the live stream tonight is she promised to fax me some poke and some huli chicken. That was the only way I would allow her on. So, hi, Kim. How are you?
Hi. Good. How are you?
Great, great. So listen, I really appreciate you coming on. Why don't we just jump right into it? Why don't we just kind of give a rough idea? What is EMDR therapy? Who came up with it? What are some of the key facts about EMDR therapy that you want the viewers and people to know?
Okay.
What does it stand for, by the way?
EMDR stands for eye movement desensitization reprocessing. So basically what that means is we use rapid eye movements during the therapy, usually after we have developed some preparation skills, taken a history, decided what we were going to work on. Those rapid eye movements help decrease the vividness of the imagery that could be disturbing to the client. And we don't actually have to use just eye movements. We can use bilateral stimulation with tapping or with tones. People will hear a beep in one side and then the other side, as long as it's bilateral. So you're accessing both sides of the body, both sides of the brain.
And how does that help? How does that help a patient, a client?
Well, it stimulates both sides of the brain. So it moves material faster than what talk therapy would do. And so what an EMDR therapist is conceptualizing is not just the eye movements or the bilateral stimulation, but taking the pieces that have been stored of a trauma, which are usually thoughts, beliefs, emotions and body sensations. You're taking those pieces and decreasing the negative impact they have, and also accessing the client's resources in their positive neural network.
Hmm. Okay.
That
And they're
makes sense?
phased. Yeah, absolutely. I mean, it makes sense
Okay.
to me, but I'm wondering, like, if somebody had never heard of EMDR therapy, how does the eye, you said the eye, the rap, and I know we're going to get to it because it isn't just about the eye movements, but how does that get into whatever they're feeling, or how does that, like, what would they expect with that? Because they might think, well, I don't want my eyes, what would they expect
Right,
from that?
right. Well, to start with, first, EMDR therapy is therapy. And so a big part of therapy is trusting your therapist and developing that warm relationship. So I'm getting to know each of my clients as people first, kind of understanding who they are, how they work, what's important to them, what their strengths are. So we're going off of that as we're developing the history. And then I'm teaching them in the preparation phase how to shift emotional states, how to
Hmm.
calm their breathing, how to relax their muscles. EMDR is a wonderfully holistic um, intervention because it really works with that mind-body connection that's
Hmm.
psychophysiological. And so we're first preparing them and building up that positive neural network resources. So they have a lot of tools in their toolbox before we start. And then once we identify what they want to work on, what's been traumatic to them, that's where we would institute the rapid eye movements. And usually um, we're kind of poking the
Hmm.
topic right before we go in because we want it to be accessed, we want it to be activated. And then they might follow my fingers, or I have a light bar, they'll follow the light bar, or maybe they have, in the office, I have buzzers. Online, they might even tap on themselves to do that rapid bilateral stimulation. Usually there's a fairly predictable process of them experiencing a lot of negative, and then generally it decreases
Hmm.
and they get to
And
a
when you say
neutral.
experiencing a lot of negative, you mean negative feelings, negative thoughts, negative memories?
Yes, negative body sensations. Everybody
Hmm.
is different how they've stored the material of traumatic incidents. So it's a unique experience for each person. But once you've done EMDR long enough, you kind of know what to expect and what happens in the process as the clinician.
Excellent. And there are 8 phases and 3 prongs. Do I have that
Yes,
right?
yes.
Okay. Why don't we just give an overview of what, and I know we're not going to be able to, we'll probably have Kim on again, but why don't we just give a rough idea of what do you mean by 8 phases and 3 prongs?
Okay, so 8 phases means we do basically the first 2 phases are about case conceptualization. They're getting to know the client, taking that history, assessing their resources. And then the second phase is preparation. So we're teaching those tools. We're doing a little bit of education about neuroscience and the amygdala and the endocrine system and how our bodies flare with
Hmm.
trauma. A little bit of education about trauma and how it affects our systems, how it feels and what it is. And then the 3 through 6 phases are basically where we're doing the processing. So we're going to decide what we're going to work on. We're going to access that. We're going to activate it. Then we're going to desensitize it with the rapid eye movement. We're going to enhance or install the positive. And then we make sure the body is totally clear of all of that. And
Hmm.
they're clear of the trauma.
In one
Um,
session, right?
well, sometimes,
Wow,
sometimes,
nice.
yeah, it's awe-inspiring for me. I love being
Okay.
an EMDR therapist because I see such results, and I can see their body calm,
Hmm.
and they come up with such beautiful wisdom that I'm usually taking notes, and I write them down and highlight them, and sometimes screenshot them for them because their inherent wisdom just kind of arises.
Hmm.
I don't know if you saw my LinkedIn video, but I really love this Hawaiian spiritual conception of us being bowls of light, and how life
Hmm.
puts rocks in our bowl and how
Hmm.
our job is to take out the rocks. And so are those rocks. And what might be traumatic to one person might not be to another person. And the pieces of the trauma might be different for some people. Some people are very body oriented, or the smell might be the most disturbing part. For others, it's very visual. So I got a little sidetracked there, but
No,
the,
that's great. That's great. I
okay.
love that metaphor of a bowl of light, which is kind of the reoccurring, not kind of, but it is the reoccurring theme in a lot of my live streams is you can't just let go of what's hurting you. You can't just forget about it. You can't just get over it. You got to get into it and you got to work on it. And what I'm trying to do is show people that these are the tools to have it. So what I'm hearing, or not have it, but these are the tools to work on it, to get into it and process it. So what I'm hearing is that there's kind of an exposure therapy kind of component of it. No?
Very little, if even that. One thing that I really love about Roy Kiesling's model of EMDR is that it's not as intense, and it really works with the client's window of tolerance. So we're not going into a lot of details necessarily. And
Interesting.
there's a spectrum of EMDR that I can do, having been trained in his model, so that I can make it more palatable and tolerable for the client. And also, because we've been doing so much preparation, they have the tools to calm themselves in the moment, and they've already experienced that their feelings aren't going to kill them, that there's relief to be had, because even the positive resourcing aspects are giving clients a lot of control, and teaching them how their body works and how their minds and emotions are all interrelated.
Interesting. And before you mentioned negative and positive neural networks. What do you mean by that?
So
Aren't these great questions, Kim?
they are great questions. Yes. The positive neural networks and negative, I think of as, well, Roy Kiesling developed kind of these pyramids, just the conceptualization that we're working with the negative things. Usually a negative belief system is a negative neural network. And in that negative neural network, say I'm not good enough, is the overreaching negative belief there. We might have something that happens to us at age 5 when we go to school, and maybe our teacher looks at us funny, and we take in a negative belief. A lot of these things are survival skills, or just, we joke about how we always have to go back to childhood to access stuff. But it's generally a time where we don't have a lot of life experience, and things happen to us, and we take in things, and we just don't metabolize them the way that we would as a 40-year-old. So those things happen to us a lot in our chronology, basically. So we might have a memory at age 5. We might have another incident that's kind of attracted to that same negative core belief at age 10. We might have another one at 35. Usually we have a lot in there, in that neural network. And then the positive neural network are the things that kind of bump up against that. I think it's kind of the health of our system that says, no, there are other examples over here. I kind of think of it as the old-fashioned scales.
Sure.
We've got the negative and we've got the positive. So part of what we're doing at the beginning of therapy and the beginning of this process is making sure that our positive neural network, those examples of health and healing and relationship, even if it's stuff that I have to kind of feed them, like, you're so dedicated to therapy, you're always on time, you're always transparent with me about hard things. Like, those are all positive things. We can take those and use them and essentially integrate and link those two neural networks.
So it sounds like the EMDR therapist is a pretty active component. It's not like just a blank screen and just, tell me how that makes you feel. It sounds like,
Yeah. When we actually do the eye movement therapy, I don't do a lot of talking, mainly because I want to stay out of the way of their process. We are all so wise when we get those rocks out. And so when I'm doing the eye movements, I want their wisdom to come up. I don't want to be interjecting something that might be wrong from me. So there's not a lot of talking during that phase. Not me talking, at least.
Excellent. No, I believe that, I get a lot of new patients, and a lot of them say, my previous counselor or whatever, they just sat there, they didn't give me a lot of feedback. And, everyone has their own style. But I think, one of the things about the new sort of wave of therapists, or the new concept, is that we are an active component. We are not the change agent. The client's the change agent, but we need to give feedback. We need to help the client reprocess things that are going on with them.
Right, because I live in a body too, and I don't do anything with clients I haven't tried on myself. I love EMDR because what it did for me, and I get to see that happen with other people all the time.
Beautiful. Normally I wait till the end of us talking, but we're getting some really good questions here. So let me just get one in here. Are there any known side effects or negative feedback from EMDR therapy?
Some people are really tired after a session. Some people are really euphoric after a session, which isn't necessarily a negative, but it depends on where the timing of our session is compared to the timing of what material we've gotten into. So if we've started working through the yuck and we haven't had time to clear all of that before our hour of insurance time is up, I try to wrap that up. We use a lot of interventions to make it comfortable, but usually they're tired. EMDR is, I talk about it kind of like therapy on speed, or it's a bit of a marathon. So people get tired. Sometimes their dreams change. They will potentially notice new thoughts, memories, body sensations, most of the time connected to what we talked about. Our systems are so interesting.
Sure, and complicated and interwoven and not compartmentalized, and
right. Yeah, so they'll have memories kind of pop in that they're like, where did this come from? But generally when something happens to us that's traumatic, I feel like our system just grabs everything in the chronology. And so sometimes things that don't seem related come up.
Excellent. Thanks, Juan. And Juan's been a frequent viewer, and we appreciate all the participation. So you mentioned that, and I was surprised to hear that insurance companies will pay for EMDR therapy?
Yes.
Beautiful.
Yeah, with a licensed therapist, it's just one of many interventions. And EMDR is a beautiful way to integrate a lot of interventions. I'm trained in play therapy, somatic resourcing, CBT, TFT, the tapping therapies. All of those I can blend seamlessly into EMDR work.
Beautiful, beautiful. And Selena's kind of taking us into the next phase of what we're going to talk about. Selena's saying, and by the way, everybody who's asking questions and participating, thank you. This is why we're doing this, because this isn't just about, me editing together a nice video and getting likes. This is about interacting with people so that you can realize there's nothing to be ashamed of. Everyone has issues. Everyone has some degree of mental illness. Everyone, just like we all have a degree of physical illness. There's nothing to be ashamed of about working on it. Selena's saying, I come from the military community. Would this be something helpful for soldiers who have PTSD?
Absolutely. One reason I wanted to do this live stream is because I am so saddened by TVs and movies that don't tell people about EMDR, because PTSD is very treatable. I can't say enough about that.
Well, let's talk about that, because that's one of my reoccurring mantras in this is that we do not have to accept that our emotional wounds are with us for the rest of our life. We do not have to hate them. We do not have to look at them like, oh my God, I'm broken. There's nothing that can be done. So yeah, let's talk about that. Where are you coming from with that?
Oh, well, I'm a military kid myself, and my dad wasn't in what the military men and women go through right now. But I am just amazed at what they generally are able to do. They meet so many demands on their whole body, on their
and they're so well paid,
Oh yeah.
Well,
That's another conversation. But
Sure,
yes,
sure.
yeah, and I have had the privilege of working with a lot of vets, and EMDR is a beautiful way um, to move those rocks out, whatever it
Mm,
may be. And, you know, a lot of times vets come in and they're not necessarily working on war trauma, they're working on the loss of the dog they worked with
mm,
in
mm,
Afghanistan. That was like their main wonderful relationship. Or, you know, everybody's trauma is different, and some things that we would think of traumas aren't, and other things that we wouldn't necessarily call trauma can be. So I don't know if I'm saying enough
No,
about.
absolutely. So do like we were talking about this before about traumatic memories. Do they have to be real? What if a client doesn't remember the details? Like, you know what I
The
mean? Like
body does.
yeah.
That's why I love this. Their body remembers. So we'll
Mm,
have people come in and they know something's wrong, and this might be a birth story about the cord being wrapped around their neck. Or I had a
mm.
client who essentially died before she was like 2.
Oh
um,
wow.
and her body held all of that, but she didn't know that. It wasn't until she
Mm,
had kind of called her mom and asked about some of the stuff that was coming up in therapy that her mom was able to fit in some of those pieces. And I remember from one of my first EMDR trainings, they were talking about a man who had a memory of standing in line at Dachau, the concentration camp, waiting to be gassed.
mm,
But this man was way too young to have had this memory, but it
mm,
was traumatizing him. And so sometimes it's the things we hear. This actually was a story from one of his uncles.
mm,
And I'm guessing a lot of women can relate. Most of us don't really like parking garages.
mm.
Have all of us been attacked in parking garages? No, but we certainly have seen a lot of movies about it with scenes. So
So that's
sometimes
interesting.
how we take stuff in can be
Hmm.
trauma.
So and well, actually, one of my Buddhist monk friends, when I was in Hawaii doing his name was Somaloka. He was a Buddhist monk, and he taught me how to meditate. And when you say the body holds the memory, help me to understand that.
Well, the person who talks about this the most is Bessel van der Kolk. He wrote the
Hmm.
book, The Body Keeps the Score.
Hmm.
We have stored memories in our bodies before we even have language.
Hmm.
And so a lot of what traumatizes us, and this is kind of what flashbacks and flooding are about, which are two of the symptoms of PTSD, is that we feel like our past trauma is present now because our body's flooding, our heart is palpitating, our stomach is not feeling well, we have muscle tension. People hold it in all kinds of different places. And some of the preparation phase that we do before we get into the more disturbing stuff is to kind of teach people to start to be aware of their body. So I'll
Hmm.
often interrupt as they're telling a story and say, where do you notice that? And so by the time we get to the reprocessing part, they can tell me their body and where they're feeling it um, pretty immediately. Did that answer
Excellent.
what you're
Yeah,
asking?
yeah, no, absolutely. Because I mean, I kind of had an idea of what you were talking about, but if someone's hearing this, they're like, "Well, wait a minute. I mean, your mind holds the memories. How does your body hold a memory?" You know, so no, that's a great way to look at it. So go.
Well, our minds do hold our memories, but when we have something happen to us that our body or that our system doesn't know what to do with, it
Mm-hmm.
gets stuck in our neural network,
Hmm. Oh,
which
so
is why
that's what you mean by body. Okay.
yeah, so a smell might trigger us to
Hmm.
H4, or the sound of a car backfiring might trigger someone who was a witness of gun violence.
Hmm.
And they feel like it's right there. The trauma feels like this. And
And
EMDR, at least in my experience, I felt like it went like this. So I can
hmm.
turn my head and remember some of what I worked on with my therapist, but it's not like this. And I can see the whole picture of what was good in my life at that time, what my resources were.
So I guess one of the things that hits me is EMDR like hypnosis?
No. Hypnosis can be used in the preparation phase if the client wants to. Hypnosis is a lot about relaxation.
Hmm.
EMDR, it's one piece, and not necessarily a piece that every EMDR therapist would use.
Okay, excellent. So, should clients ever use these eye movements on their own? Is that something that you would recommend, or do they
No,
like get these tools if they, yeah, okay, good. Talk about that. Why not?
no. Basically, because when you're using the eye movements, we're activating and accessing and activating. That means your gunk's going to come up, and it's very uncomfortable. So we don't generally suggest that clients do this on their own. We want them to feel supported. We want someone to be there to guide them. And part of what we're doing in that early preparation phase is teaching them other ways to use bilateral stimulation.
Hmm.
Um, there's one that I really love that's called walking it through, where we use just slow feet tapping, not running, just walking, and they're noticing the positives. So I would encourage them to use the other skills that we've learned, but not necessarily go into reprocessing traumatic material on their own.
Okay, and LaShonda is asking just one word question, desensitization. So I guess she wants to know, what does that mean?
It's basically bringing down the distress of the image or the body sensation.
Hmm.
Yeah.
Through what mechanism does that?
Usually through the rapid eye movements or the rapid bilateral
Gotcha.
stimulation. Yep.
Gotcha. Okay. Steve is asking, and I'm going to just interweave some of our questions with some of because these are right on track with what we're working on. Says, my EMDR therapy has just started this week. I'm struggling to recall certain trauma. I know it's impacted me, but I can't recall specifics. Should I just stick with feelings, fear, etc.?
Sure, you could. And, as you get into this more and your therapist guides you, something might come up. But you can absolutely go in through a body sensation or an emotion as well. The therapist will lead you through that 8-phase process. So they'll ask you specific questions to kind of elicit some of this information. Um, they're not all EMDR trainings are created equal. We do have a governing body called EMDRIA, the International Association of EMDR, and they set the standards for the trainings. I'm not saying anything about your specific therapist, just that some people say that they're doing EMDR and they're not. So you want to make sure that they know about those 8 phases, the 3 prongs. They've been through a training that most of the trainings are about 50 hours or 40 hours, depending on the training, of 20 hours of lecture, 20 hours of practice, and then there's consultation after as well for the clinicians. So it's a
It's a
intense
body of
process.
knowledge. Yeah, it's a body of knowledge that you need to learn, and that's why
It
I've
is,
never used it, because I don't want to use something that I'm not well trained in.
right.
And again, one of my mantras is, if you're getting mental health help, advice, whatever, if you're working with somebody on the internet, if you're listening to podcasts, if you're please make sure these people are licensed and trained. Okay, because just because you had depression and you found a way to deal with it doesn't mean how you dealt with it is going to help everybody.
Right.
So when people start messing around with people's emotions and memories, things can go haywire pretty quickly.
And again, I'm not saying anything about that particular therapist.
Absolutely.
I
Absolutely.
I actually would not recommend that you jump right into trauma the very first session. You
Bingo.
want to get to know your therapist and trust them, and you want them to know you and feel like they're the right fit for you and all of that stuff. So it's okay if all the trauma stuff isn't like right in your face the first session. There's a lot of work to be done before that, so that this is as comfortable as it can be process. I saw someone talk about how flooded, if the client
Yeah.
could
Yeah.
get
Yeah.
flooded, they
Know what that?
absolutely could. So knowing that as the clinician, I want to titrate that so they're not overwhelmed. So therapy is generally a comfortable process with a trusted person that basically knows the lay of the land and can guide them through that process with a minimum of distress. Especially with trauma, they're already distressed enough. I don't want therapy to be a negative experience.
Absolutely. And Steve's bringing up another good point. He said that it'll be tapping, not eye movement, as it's not effective over a screen, COVID restrictions. So do
Oh,
you do most, yeah, go.
no, eye movements can absolutely be done over the screen.
Hmm.
Literally, I could be doing this with a client, or I have a light bar, which is like a light bar on a tripod, and the lights go across the screen. You
Hmm.
can do tapping as well, and you can do eye movements and tapping as well. So you can absolutely do EMDR virtually with eye
Oh,
movement.
okay. So you do a lot of virtual appointments and
All of mine are right now. Yes.
okay, great. And just real quick, if you want to get in touch with Kim, this is her website. So I'll leave that up so you can write that down. So Sammy is asking, is there a difference when you do EMDR with children versus adults? Great questions coming in, man. These are awesome.
Yes, they're very fun to work with. They don't have as much life experience. They don't have as much gunk in that neural network. So generally it goes a lot faster.
Hmm.
um, they love my buzzers, which are another way to do bilateral stimulation. They'll put them under their neck and they literally buzz. They're like little vibrating things you can hold in your hand. And kids never just hold them in their hand. They're under their armpits and they're under their butt and they're stepping on them to make them giggle with their feet. So there are a lot of fun ways to do EMDR with kids, and you can integrate play therapy beautifully with the EMDR conceptualization and all the tools.
Beautiful, beautiful. Michelle's asking, I feel like I may dissociate a bit too much. Is that possible? So Michelle, I'm assuming you're saying you would dissociate during an EMDR session or in general. And then she's saying also it scares me, the loss of control of sense of self, I think.
Sure. So dissociation does come up quite a bit with EMDR because we're paying attention to hard stuff. So
Hmm.
the therapist is aware that that's going to come up. There are dissociation is addressed in the basic trainings. There are also specialized trainings. We all dissociate at some level. We all have watched TV and forgotten what show we're watching when the commercial
Hmm.
comes on. And that's just one end of the spectrum. So I usually normalize why we dissociate. And then I work with a client to identify when they're doing it in session. And if they're dissociating in session, that means maybe we're going too fast or too deep. And so we slow down and make it tolerable. And there are lots of ways to do that with Roy Kiesling's model.
And that's the key with working with a licensed, trained mental health professional is we know from years and years and years of doing this work with people when we're going too fast. And a lot of times I use that example of the American sniper gentleman who took his help, trying to help one of his fellow soldiers. He took a soldier struggling with PTSD, but he took him to a shooting range. And unfortunately, the gentleman got flooded and he ended up killing him and other people on the range because he got too flooded. So that's key, people. When you're thinking about working on trauma, you've got to work and find people who know how to administer it based on the feedback they're getting from you, because we're judging you, not judging you negatively, but we're looking at you based on the thousands and thousands of other clients we've had to know where you are along the way.
Yeah.
So Samantha, who's a great longtime viewer, is asking, does it work with nightmares? Can this
Yes.
work?
Yes, it does. Because it's kind of like memories are kind of like a nightmare, or nightmares are kind of like a memory, right?
Hmm.
So we absolutely can work on nightmares.
So it helps with suppressed memories and
Yep, because the body holds the score.
excellent. So Kat is one of our, also, she's on a lot. Kat has dissociative identity disorder. So she's asking, is this a good treatment model for somebody with DID?
It can be, but you want to find an EMDR therapist who knows about DID and has taken those specialized trainings.
Hmm.
So you want someone who knows about parts work, who knows about dissociation, and has experience using EMDR with us.
Excellent. Excellent. Kelly's asking, I'm going to assume, Kelly, this is an honest question and not, because sometimes we get people joking around, but have you ever worked with a one-eyed patient? Do the eye movements work on one-eyed people? Somebody maybe has had trauma to one of their eyes.
No, that's a good question.
Actually, it is. It's now that I think about it, because war veterans, there you go. So
absolutely.
thanks, Kelly.
And yes, you can, because if the client wants to do only eye movements, they're just bilaterally tracking. So I'm just watching, like if you take off my glasses, I'm just watching that their eye tracks from kind of crossing the iris to the other. So ear to ear, kind of.
So they're just going back and forth and that. Okay, excellent,
Yes.
excellent.
And if they don't want to do the eye movements, there's the other types of bilateral stimulation.
Beautiful, beautiful. So what about combining EMDR with psychiatric meds? What's your thought about all that?
You can do that. Depending on the medication, sometimes that's blocking some of what could come up. And so not that you're not going to have good results, it's just that you might have to go back and do certain things over again. If, say, they're not able to access certain emotions, say if they're taking certain anti-anxiety medications, or I would prefer that my clients are not using street drugs to self-medicate.
What about marijuana? Like if they have a marijuana card or?
Yeah, marijuana can be great for a lot of other symptoms, but when it comes to EMDR, it makes the work longer because we have to kind of going through and working on things that we've already worked on sometimes.
Short-term memory, yeah.
Yeah, different therapists have different ideas about that.
Great. Excellent. Excellent. So Diego is also a longtime viewer. He says, good evening, doctor. What is the duration difference on this program versus traditional counseling, given the person has similar mental health?
It's a lot faster generally once you're into the reprocessing phase. Now, preparation and the stability of the client, which I think is really important, especially when we're going to go into negative stuff that's activating their body and their emotions, that can take longer. And there's still attachment, developmental issues. Just because you're moving a trauma target doesn't mean the person necessarily has the skills to go be healthy and happy. So if they had a I'm not lovable type of target, we can move that target and they can believe that they're lovable. But if they don't have the skills of being respectful and assertive and communicative and all the other things that you need to have a healthy relationship, that takes longer. It also is depends on whether we're talking about like a simple trauma, like a one car accident, or years and years of childhood abuse.
Sure.
So it depends, but generally EMDR is faster. That's one reason I like it as the clinician, because I see people getting better. I see them being happier. I see them reporting these aha moments and these different interactions. And it generally goes faster. things that they've held on to for 30 years are gone.
Now, when you say gone, does that mean they have they don't experience? She knows where I'm. So
I knew if I said that word. Yeah.
No. But I want people to sort of get a realistic idea. Does that mean by gone they don't have any more memories? They don't have any more flashbacks? Like they're just always happy? Like, what do you mean?
So you do have the memories. They're just stored functionally, adaptively in your neural network. So you're not having the symptoms of trauma, like flashbacks, like nightmares, like intrusive
It's not as
thoughts.
acute. It's not as diseased, so to speak.
Right. And I do mean gone. Like if you really work on that neural network, which could take a while, depending on how much is in there, how old the person is, what type of experiences they've had. But if you really excavate it, it's a memory. Like we can all think about things that have bothered us, but they're memories. They don't like flash us with, hijack us just because we smelled something. So Yeah. I mean, gone.
That's awesome. That's
It's
great.
awesome.
So, when somebody's working with you, like, give us an example. I mean, obviously we can't talk directly about a specific client you've worked with, but can you give us sort of an idea? Just maybe, I know this is a bit unfair, but like, can you think of a client that you had and sort of give us an idea of where they were and where they are now? Because one of the reasons I'm doing a lot of these is because people need to understand that they do not need to stay broken. They do not need to believe that people can't change. They do not need to believe that you can't teach an old dog new tricks, and all these colloquialisms that we use to stay in trauma, to stay hurting. So can you just give us a just sort of a real life example of somebody who went through the treatment and where they were and where they maybe are now?
Sure. When you first asked, I was thinking, okay, chronic childhood abuse. I had one client with a diagnosis of PTSD. She had a lot of those markers. And now I would diagnose her maybe, and I only have to diagnose her because of insurance, but
Sure.
more on a general anxiety
Hmm.
type diagnosis. She's not having flashbacks. She's not having flooding. She's not even having nightmares, which was one of the last things that we worked on. Um, I mean, she had very severe childhood abuse, lots of beatings like out of nowhere. So
Hmm.
lots of hypervigilance. She was always trying to protect herself. And
Hypervigilance, just so people don't know, is you're always waiting for the next
watching your
trauma to
back.
come. Yeah,
Yeah.
yeah.
Yeah. And when you're kind of used to getting punched just because you turned left versus right,
Hmm.
um, yeah. So there's there are those examples. I've also worked with people who have said, I have one thing I want to work on. I don't want to talk about my childhood. I want this one thing. And they're done in a few sessions. Usually we're still I'm trying to build that rapport, and I want to make sure that they have the coping skills that they need before we go into the trauma, but also before they leave my office. Um, I had one client who would clear, and to go through all 8 phases. Usually, you're not doing that all in one session, but she would
Sure.
do one session and done. And
Wow.
I'd be like, "Wait a minute,
Right,
there's
right.
something wrong. I did something wrong,
Sure.
or she's telling me what I want to hear." But we'd check it the next week, and it didn't bother her anymore. So everybody's different, and there are all kinds of different stories.
Beautiful. And so Steve's following up with some great question. Is there anything we can safely do outside of the session on our own to assist the healing on a more deeper level? Journaling, maybe? What are your thoughts about
Yes,
homework or?
journaling is great. I teach acupressure. I teach clients EFT, which is acupressure points on their body and torso. I'm trained in TFT, which is basically another version of that. I do lots of guided visualization. I am a huge believer in sleep, nutrition, and exercise. Exercise
Mhm.
mainly because it's moving all those stress hormones. If we're traumatized, our brain is always firing off our amygdala, our flight or fight. And so exercise, first of all, is bilateral stimulation generally, but it's also moving all of that through our body. So those are some things. I teach deep breathing immediately. I know that seems yoga and new age and all that, but when we're breathing
It's new
deeply,
age, but it goes back thousands of years.
absolutely. And it turns our amygdala off. And when
Mm.
we're in our amygdala, which is this little reptile brain of ours in the back of our neck, we can't access this part of our brain, which has all that hope and healing and higher thinking and problem solving. And so when we're breathing and when we're breathing well, we have access to all these other resources.
Mm.
So I do a lot of that. I do a lot of grounding exercises, mindfulness, absolutely. In fact, EMDR is considered a mindful intervention. So
Excellent.
I
Yeah.
want clients to be able to notice what's happening in their body.
And again, like we did a live stream on mindfulness, and remember, mindfulness is thinking about your thinking, being aware of what is going on in your mind. So, let's see. Michelle was following up and saying, for needing to feel in control, is it okay or safe to stop at any moment with EMDR?
Absolutely. Absolutely, yes. Usually by the time we get into the rapid eye movement, again, we've worked on stabilization and safety. They've had practice with tolerating distress. They know that they can move it because we've done some state shifting exercises. But absolutely, if something is too much, we can stop. But also, usually I'll talk with them about the spectrum of EMDR that I can do. There's a very contained version, and there's a very unrestricted kind of whatever's in the bag type of version. So we can titrate and play around and see what they're comfortable with before we even start. I have not had many people say stop.
Excellent.
Yeah.
Okay, and Kelly's following up saying, I asked the question about one-eyed people as a legit question. I lost my left eye when I was 14 months old. This type of therapy fascinates me, as this is obviously a very old trauma that I don't recall, but feel it is a contributor to my lifelong depression. So Kelly, again, I apologize, didn't mean to offend, but you'd be amazed. We get trolls on here who ask questions for the sake of being. So, well, thank you for sharing that. So what are your thoughts about what Kelly said?
Well, in one of our last trainings, we had a clinician who was legally blind, and
Oh, wow.
we have to practice on each other in the trainings. There is practical, experiential training, and she could do the eye movements fine. But even if someone is blind, you could do bilateral stimulation that isn't necessarily eye movements.
Gotcha. Okay, great. And Juan is asking some really good questions because this is something you and I had exchanged some emails on. Does this therapy sort of accelerate the plasticity of the brain, like with kids? That we like with kids, what we want is right brain and left brain connections. The way we parents try is through different exercises and games.
Yes, I'm a huge fan of neuroplasticity.
Right,
And I
right.
think in epigenetics of changing our DNA, I
Mhm.
absolutely think that these psychophysiological interventions, yeah, absolutely. Neuroplasticity and epigenetics.
And just to give people a quick Reader's Digest, by brain plasticity is the idea that, many 20, 30 years ago, people believed in the hardwired brain, that the brain was hardwired a certain way and there's nothing you can do about it. That paradigm has now shifted more and more into brain plasticity, which is the idea that our neurons, the actual physical connections in our brain aren't actually hardwired. They're plastic and they mold themselves based on our experiences and our thoughts. Epigenetics is the idea that we're born with a specific genetic predisposition, but then the environment starts switching those genes in a certain way, which then expresses itself in behavior. And I'm all for any ideas that say we are not doomed to think and feel a certain way. So Kat, one of our viewers who's the dissociative identity disorder, saying, I have a personality that's extremely dangerous. Is there a high risk of triggering her and putting the whole system of her alters and everything in danger from using EMDR?
I would be careful and find an EMDR therapist that is specifically trained in DID. Yes.
Definitely.
Without knowing too much more, I think that's a safe answer.
Absolutely, because people don't really understand a lot of times, Kim, people like do what we do on a daily basis. Our nightmare is doing anything that causes a patient to be harmed. People don't understand that we have to always be navigating around what we feel the patient can handle. And a lot of times it's why a lot of practitioners get out of the field, because they just can't handle that fear of doing something. So Kat's question is excellent, because it just really incorporates this idea that we don't want to hurt anybody. We don't want to do anything that's going to cause our patients to be harmed, because believe it or not, that will affect us too. We will feel that.
And I think that's one of the reasons I've been in this field so long, is because I've been trained in EMDR maybe 12, 14 years. I can't recall at the moment, but it has made my vicarious trauma, listening to other people's trauma, less, because
Wow.
it's helping them, because there's movement. because this is a tool that really works. So I would suggest to Kat that if she's looking for a certified EMDR therapist, and I would recommend a certified one.
Who has experience, like you said, in dissociative identity
Right.
disorder.
Right. So she could go to EMDRIA, EMDRIA.org, and look up a certified EMDR therapist. What that basically means is it's not someone who has only gotten the basic level of training. They've then jumped through the hoops. They have worked with a certain number of clients. They have worked with a consultant to really fine tune and deepen their conceptualization of EMDR. That website is actually for consultation for clinicians. My colleague and I run
Gotcha, but they can contact you and ask questions and sort of get some
Yes.
guidance. And
Yep. Yep.
Great.
So yes, when you go on the EMDRIA website, you can find certified EMDR therapists, and also their specialties are usually listed alongside their qualifications.
Beautiful. Andrew's asking a good question. Has Kim ever experienced where EMDR didn't work immediately or there was extreme resistance?
Yes.
As we all have, right?
Yes, absolutely. I feel like sometimes these targets don't want to go, even though they've caused us great distress. At one point, I have to remind clients that the creation of a target is usually an adaptive response in the moment, and then we grow, and then we learn new things, and we develop different skills, and then they don't work so well anymore. They hurt us. And so sometimes the targets don't want to lose that position. I kind of conceptualize them as a different aspect of self, which some therapists may or may not agree with. That's just my
No, I feel you. And dissociative identity disorder is just an extreme version of what we all have. That feeling that we have multiple selves, we have multiple different feelings within us, even personalities in different situations. So I hear you. So you're saying the targets. What do you mean by that? The targets don't want to move. What do you?
They don't want to go.
Yeah.
Well, sometimes, like something with, gosh, I'm trying to think of an example. It isn't exactly a target, but I remember working with an alcoholic client, and he needed to say thank you to how his alcoholic behaviors had served him at some level.
Wow,
And so
interesting.
sometimes some of this work, we need to honor the fact that the targets helped us through something. Like if I had a target or a negative core belief of I'm stupid because of an early elementary school situation, I could have taken that, and the behaviors I develop around that target could be that I always study extra hard. I sit in the front of the class. I make friends with the teacher. There are some adaptive behaviors surrounding that negative belief that hurts me. So we have to, as the therapist, look at why we do what we do. And that's why you want to work with a therapist on this, because you're developing that relationship, and hopefully they can reflect back to you, that doesn't quite fit with the other things that you've told me. And what would it be like if you didn't live with this? What would it be like to believe I'm good enough, or I'm safe, or, it's not my fault?
And that's an interesting, we could do a whole show on that, about how our negative, dysfunctional whatevers that we've been dealing with our whole life actually have brought some positive growth, post-traumatic growth kind of ideas into us. That's So LaShonda is asking, so it's good for individuals with complex PTSD?
Yes.
How so? What do you mean? Like, how could it help somebody with complex PTSD?
Well, because we're dealing with the negative and the positive neural networks, you can grab a lot of content in those rapid eye movement desensitization sessions, and then you're linking with the positive. It's not uncommon to have identified a couple memories, disturbing memories in a neural network. And if we do it a certain way, if we do the EMDR in a certain way, some of the other memories that we targeted, by the time we're done with one, those might not have any disturbance left. So this therapy, depending on how you do it, again, I talked about that spectrum of contained and restricted and unrestricted. can clear out a lot at one time.
Hmm.
Kind of that
Excellent. Yeah.
extreme.
No. But yeah, and just so that people may know, what is the difference between complex PTSD and just I hate to say normal PTSD, but you
Right.
gave it a little bit earlier, but
Right. Complex PTSD, for example, could be a military person in combat. There's the combat stress. Maybe they witnessed a friend's murder, death. Maybe friends and people after they are out of service have committed suicide. Um, they also might have childhood abuse, sexual abuse, relationship issues. Complex just means it's kind of layered, that
Mhm.
there are a lot of things.
And elongated usually, right?
Yeah, usually across time.
And
Yeah.
PTSD in general can be just like, your life's going along fine and then spike, boom, a huge trauma, and then you come back down. Okay.
Right,
Not down, but you know what I mean? Then you kind of try to reestablish some sort of
right.
baseline. So Angie is asking a great question. Is REM sleep something like EMDR? Someone told
Yes,
me that nightmares are my brain trying to work around and through stuff.
yes.
I wonder who told you that, Angie?
Maybe it was you. Yes. The rapid eye movements are very similar to REM sleep, and yeah, I'm not sure what else to say.
Sure.
Yeah,
No. But I think what we're getting to is the idea that that EMDR can help people probably sleep better and get
yeah,
into those more healing REM sleep stages.
right. Well, also, I come from a dream interpretation background as well,
Right.
so I think that our psyche has a different way of speaking to us through our dreams, and so who knows? Sometimes those nightmares are not nightmares. Those dreams of being chased are actually someone trying to give us a gift. Maybe we dropped our wallet on the subway platform and they're trying to come after us. A lot of different ways to massage that. But yes, the eye movements are very similar to REM sleep.
Beautiful. And I guess in closing, I guess what I would also like to, or you mentioned something in one of your emails to me that this, again, not stigmatizing mental illness or mental health, but for people who don't have a lot of trauma, people who don't have any specific, deep emotional wounds or anything, they've gone relatively unscathed and they're looking for peak performance or they're looking to just enhance, move to another level business wise. What are your thoughts about all that?
EMDR is great for that too.
How does
Yep.
that, how would somebody who's maybe trying to be more up their performance or an athlete, how could they benefit from EMDR?
Well, it would potentially be a little more subtle process where maybe they don't have a trauma staring them in the face, but maybe there are some beliefs that are holding them back or um, kinking them up in some way. There's also ways that we can build those resources and use the bilateral stimulation in the preparation and the resourcing
Hmm.
that can enhance peak performance.
Okay, great. Well, look, we could talk about this all night, but I try to keep it to an hour, and even from what I'm being told, that's too long sometimes. But these are deep topics. So, in closing, Kim, what message from a mental health clinician who spent what do you want the public to know about this? Like somebody stumbled upon this on YouTube or Facebook. What's a kind of closing thought about EMDR or therapy in general that you want to leave viewers with?
Mm. Well, I love therapy as a whole, but EMDR is one of the most robust, holistic, um, comprehensive interventions that I use. That's why I consider myself an EMDR therapist, and all the others are adjunct. I would suggest it to people that are hurting and or seeing not a lot of results in the therapy that they might be doing. There are ways to excavate and move those things out. We do not have to live in suffering,
Hmm.
and I think that's my main point.
Let's say a clinician is watching this and they want to add this to their toolbox. What you do trainings? Let's talk a
Yes,
little bit about that.
yes. I've been working with EMDR consulting. I'm a coach in training. I'm not a trainer yet. Eventually, I would like to be that, but I really love our team. Um, EMDRconsulting.com. It's the training program developed by Roy Kiesling, who worked with Dr. Francine Shapiro, who originally came up with EMDR. It's very elegant, very holistic, very gentle way of doing EMDR. And that is not always what you find with certain trainings. But now all the trainings are virtual. I am a coach in training for the Hawaii and Washington state trainings. So basically they're based on time zones now. So we have people from Maine joining us in our Hawaii training and ending at 10:30 p.m. So yes, they can go to emdria.org for all the trainings under the EMDR umbrella, and emdrconsulting.com if they're interested in specifically what I've talked
And
about.
if anybody has a question to you specifically, emdrnetworking808.com is a way that they could go on. There's a link probably to contact you, or if they have questions.
Yes, that's mainly for clinicians that are seeking consultation, but yes.
Okay. Well, again, we could talk about this for hours, but I do appreciate you coming on, Kim. And, thank you for being on the front lines. People don't really understand how we in the mental health field are trying to help in our own way, keep society moving forward with the idea that we can heal. So I appreciate everything you do, and love to see you again. So thank you for coming on.
Thanks for inviting me. Yes, thanks for having me.
Thanks, Kim. I'm going to close out, and then I will talk to you again. Okay. Thanks.
Okay. Thanks.
Okay. Take care. We'll see you. Okay, guys, that's a perfect example of what I'm talking about. Here's a clinician on the front lines doing work every day that we're trying to do to help people. So again, please do the work on yourself. Do not buy into the idea that you have to suffer in silence and you have to be hurting all the time. I'm going to continue to bring on different practitioners in the field so that you guys can get an idea that there's nothing to be afraid of at this process. We are here. We are trained to help you. So again, if you're catching this on Facebook, please like our page, subscribe to our the YouTube channel. Please set your notifications on YouTube so you know when we go live. And also, please like any videos and share them so that we can normalize conversations about mental health. Again, check out helpahuman.org. It's a fund that I've set up so that people who can't get help or can't afford it, you can donate to that fund and we can help them. I'm hoping to get other clinicians involved in that too. So again, thank you for coming on. I'll be on next week. We've got some more guests lined up. We're going to have some interesting topics, but please tell people about the channel. And again, take a look at multiple different options you have to heal. Okay, guys, this is Kim. If you want to get to Kim's, you ask her some questions. That's her website one more time. And then I will see you again Tuesday night and Thursday night, 7 p.m. Mountain, 9 p.m. Eastern, and then down the coast. All right, guys, have a great night. We'll see you soon. Thanks again to Kim, and I'll see you next week. Take it easy. Do not give up on healing. Do not subscribe to the idea that you have to stay broken. There are many, many interventions out there that you can use, that you can heal. Do not give up. Do not give in to hopelessness. Okay. All right.